Okay, we'll talk some medical talk for you this morning, specifically acid reflux, otherwise known as GERD. Most of us will probably have it from time to time, but if you deal with it in a chronic way, it can really get in your way. So we're very happy to welcome back to the show Dr. Rishabh Shah, who is with CHI Memorial Surgical Associates. Good to see you this morning.
Good morning.
So I was kind of winging it there, but I hope I'm right, because acid reflux and GERD are really the same thing?
Yeah, well, GERD is a spectrum of symptoms that come from not having good control of your stomach contents, and heartburn or acid reflux is one of those symptoms.
Okay, so does that mean, because I know we're going to talk about this treatment that has been around for a while, but y'all are offering it now.
Yes.
In Chattanooga. So is that, is it specific for a certain type of GERD or anything?
Right, so millions of Americans suffer from GERD. Sometimes it's diet related. But sometimes it's related to a disease called a hiatal hernia. Normally our stomach is supposed to be completely in our abdomen, below our diaphragm. Our diaphragm is our main breathing muscle. In some people, that stomach can actually creep up into the chest. And when that happens, it affects our natural anti-reflux valve.
Okay.
So in those people, sometimes surgery is the right way to go to correct their reflux.
So this procedure that y'all have now that you're offering is specifically for those people who are it's not a diet causing their problem, it's an anatomical issue. Is that right?
Exactly. In most people who would be TIF or C-TIF candidates, either the valve has become loose, or because of the stomach moving up into the chest, it has become just non-functional altogether.
So prior to this procedure, what has been the method of treatment?
So the method of treatment prior to this was to do a surgical wrap of the stomach around the esophagus. And the technical term for that is fundoplication.
Okay.
When you do that wrap of the stomach around the esophagus with surgery, whenever the stomach squeezes, it's going to close off the bottom of the esophagus and prevent the contents of the stomach from going up into the chest and up into the mouth.
Okay, but this is less invasive?
This is done through an endoscope as opposed to a surgical procedure. And we've partnered with the gastroenterologists at Galen Medical Group, specifically Dr. Olds, and I are doing these together.
Are they day procedures then?
24 hours in the hospital.
Okay.
And as we do more, I think we'll move to the point that potentially there will be day procedures.
So you had mentioned at the beginning of our conversation that millions of Americans suffer from some form of GERD. How many of those generally have this anatomical issue?
Lots and lots of people have hiatal
Really?
hernias. Yes, lots and lots of people have hiatal hernias. Sometimes they're very small, and still in very small hiatal hernia cases, we would recommend medication as the first line. But some people don't want to be on medication lifelong. And for them, this TIF or a hiatal hernia repair is an option. And then some people, the medication is not effective anymore.
So, you know, you're right. A lot of people do have hernias, and I wasn't putting two and two together at first, and my apologies for that. But there is a difference. There are different types of hernias, right? Because I've always thought of a hernia being caused from strain or heavy lifting, but a hiatal hernia, is it something you're born with?
So in prematurity, some babies are born with hiatal hernias and with reflux issues. For most people, it's actually from having chronic high pressure in the abdomen over time. And what I tell my patients when they come to the office is the diaphragm is a muscle. It's not like bone. It's not a solid thing. It can stretch, and over time, if you have high pressure in your abdomen, either from having poor bowel movements or from having extra weight, or from other reasons, that muscle can stretch out over time and allow your stomach to ride up into your chest.
Oh,
so we talk a lot about making sure that we just don't treat things with the procedure, but also treating things with diet.
Okay, so if you have a family history of this maybe, but if you kind of begin to pull things back and you realize maybe there are some dietary habits that aren't ideal, some weight issues that could be controlled, that might be the cause, not a genetic thing.
Right, exactly.
Okay, so if there is that genetic, or if there are those issues to be dealt with, diet and maybe some weight loss, do you target those first to see if they're going to remedy the situation, or will it not work?
For some people with very large hiatal hernias, it's not going to work. And even in those people, the TIF is also most likely not an option. If you have, if you have a large hiatal hernia, you need to have a traditional surgical repair, which is still done minimally invasive, 5 small incisions, about this big.
Right.
But yes, for everybody, whether they get surgery or not, I go into detail about dietary changes.
And I do think it's relevant to mention that you said this is new, if you will, to Chattanooga.
Yes.
But the procedure is not new.
It's about 15 to 20 years old at this point. I think over 20,000 have been done across the country.
Very vetted.
Yes, exactly. I personally, there's been a lot of things that have come out over the years around reflux, all sorts of devices. I personally am very cautious when it comes to that, so this is one that I feel is safe and effective.
Well, here's how you can find them. And would they need a referral to your office, or can they?
Go to your gastroenterologist.
Okay.
Or you can call us directly. We can work you up as well.
All right, well, here's their number. It's Dr. Rishabh Shah. He's at the main office there on Glenwood Drive. 698-8692 is the phone number. You can always learn more at the hospital's website, which is chimemorialmedicalgroup.org, and then just do /surgery. Just remember this TIF, am I saying it right?
Yes, TIF.
Is minimally invasive, not
Yes.
what you're thinking of as in the past.
Right.
Thank you for the education.
Thank you so much.